Hello, back again with another episode of Real Health Talk with Dr. Coring. For those who do not know me, my name is Dr. Coring. I am a board certified internal medicine physician who's now training to become a hematologist and oncologist. And it is my pleasure to essentially educate patients, to improve health literacy, and to educate common folks such as yourself regarding various health topics to promote wellness. And today, I would like to discuss a disease called peripheral artery disease. This is a disease that primarily affects adults because of a buildup of cholesterol or plaque in the arteries, specifically the arteries of the lower extremities. And so the way this disease manifests is leg pain. And so typically patients have frequent leg pain that goes away when they rest or relax. And the leg pain tend to get worse when they walk or exert themselves. And so if you frequently have leg pain that goes away when you relax or rest or sit down, and or you are over the age of 50, then you may be suffering from something called peripheral artery disease. Again, this is a disease that manifests as a buildup of fatty deposits, i.e., plaque and or cholesterol, that essentially narrow the blood vessels within the lower extremities. And when this happens to the body, it can cause discomfort. The main symptoms of peripheral artery disease, or PAD, that's how we abbreviate it, is pain, specifically pain and or cramping in the limbs, the lower extremity. So lower extremity pain that typically goes away with rest. However, there are more symptoms that can happen with this disease. Coldness. And so if your legs typically get cold, if you're experiencing cold legs is another symptom. Discoloration of the legs is also very concerning. Numbness or weakness is also a concerning finding of PAD. Also, sores, wounds that don't heal properly can also be concerning. Frequent infections of the pain, swelling, frequent infections of the leg or the lower extremities. Also, swelling, redness, increased fluid within the leg is also a risk factor or a symptom, I would say. You may notice less hair, less nail growth in the lower extremity. That's also concerning and can be a symptomatic finding of peripheral artery disease. And the next topic I would like to discuss, or the next thing I would like to discuss regarding this topic, is risk factors. Why would somebody develop peripheral artery disease? What are the risk factors of peripheral artery disease? Well, it turns out what put you at risk of developing this disease is the same thing that put you at risk of developing increased cholesterol or plaque. You see, this is a disease that's manifesting as something called atherosclerosis. What that means is a fancy way of saying buildup of plaque and or cholesterol into the arteries. This is a arterial disease, meaning this is a disease of the arteries. And this is a disease that is caused by increased buildup of cholesterol within the arteries of the lower extremities. So things that can cause increased buildup of cholesterol in the arteries of the lower extremities put you at risk for developing peripheral artery disease. So high cholesterol, for example, is one of the primary risk factors. Smoking is also a major risk factor. Diabetes is also a major risk factor of this disease. High blood pressure is also a major risk factor of this disease. In fact, as far as grading the risk factors, as what put you at the most risk, in order, it would be diabetes. You're 4 times at increased risk of developing peripheral artery disease if you're diabetic. And what can decrease that risk is managing your blood sugar. So essentially, an A1C less than 7 or well controlled uh, blood sugar, meaning your A1C is well controlled, greater than, less than or equal than 7, uh, pretty much reduces your risk. Smoking put you at 2.5 times as likely to develop the peripheral artery disease. Therefore, decreasing or stopping smoking cessation is the primary way to reduce that risk. High cholesterol, hyperlipidemia also put you at risk. It put you at risk maybe 1.5 times as likely to develop peripheral artery disease, and therefore we track the LDL. So controlling your LDL, mainly reducing your LDL to less than 100, ideally if you're diabetic, less than 70, can really reduce your risk. And lastly, high blood pressure put you again at 1.5 times likely to develop peripheral artery disease. Therefore, reducing your blood pressure to a target goal less than 130/80, meaning your systolic over diastolic blood pressure, can also reduce your risk of developing peripheral artery disease. And so we talked about the risk factors. We talked about reducing these risk factors. Immobility also is a risk factor. So sedentary lifestyle is a risk factor for developing peripheral artery disease. And so increasing your exercise, increasing your daily activities can also help reduce the risk and also help prevent the disease as well. And so when should you be concerned? Well, again, you should be concerned about this disease. One, if you fit into the category as far as the risk factors. Two, if you're having symptoms of peripheral artery disease, meaning pain in the lower extremities that really resolves when you rest. Also, we talked about decreased wound healing. We talked about cold legs. Also, we talked about numbness and tingling in the lower extremities. But you should be really concerned, and you should actually seek medical attention almost immediately if you're having essentially leg pain that's disturbing your sleep, and or if your legs are severely cold, pale, no hair growth, if you're having a severe infection. Also, if you don't have pulsation in the lower extremities, you can't feel your legs. If you can't feel your legs, that could be a medical and or surgical emergency. And so therefore you should be really concerned and seek medical attention right away if you are at the place where you can't feel your legs. If you fit the risk factor category and or you're over the age of 50, you should consider being screened for peripheral artery disease. And so therefore, if you're over the age of 50, you're a smoker, you have diabetes, you have hypertension, you have high cholesterol, you're having these symptoms of leg pain, you should see your provider and get screened for peripheral artery disease. The way we screen for this disease is really, really simple. What we do is basically check your blood pressure around your ankle and also check your blood pressure around your arm and essentially compare the two. And we basically call this a ABI, ankle brachial pressure index. And we measure this ankle brachial pressure index in order to basically diagnose you, essentially. And, therefore, if you meet the criteria of basically peripheral artery disease based on the ankle brachial index, then that may be an indication for further investigations and in further studies, and or maybe a indication to start treatment as well. The best thing that you can do, however, to prevent and or actually treat peripheral artery disease is basically modify your lifestyle. And so reducing smoking or stop smoking, controlling your diabetes, controlling your blood pressure, being active, developing and adopting an active lifestyle is very, very important. All right. And also, again, controlling your cholesterol. is very important as well. And so that's my time. I wanted to bring awareness to this disease. It's a common disease, peripheral artery disease. It really affects Americans essentially at a alarming rate. 1 in 20 Americans over the age of 50 have this condition. And it's more common in African Americans. All right. And so that's one of the reasons why I wanted to talk about it. It's a very common disease in people of ethnicity. And so that's what stimulated the talk. I want you guys to think about this disease if you fit the risk factor bill. I talked about that. And or I want you guys to seek medical attention if you're having symptoms and having these signs that I discussed early on in the discussion. And or if you fit the risk factors and you're over the age of 50, I want you to talk to your primary care provider about getting screened for this disease. All right. And so those are the most important takeaways. This disease can lead to limb loss. If you heard about people having to get their limb amputated, this is the disease that essentially caused this. All right. And so to save your limb from being amputated is something that we should pay attention to early on. And so the way we pay attention to this early on is essentially getting screened for it. Okay. But we have to understand why and who should be screened for it. And so if you're over the age of 50 and you're a smoker and you have diabetes and you have high blood pressure and you have high cholesterol, you should get screened for peripheral artery disease to catch it soon before you require or need a leg amputation. All right. That's my time. I love you guys. Like and subscribe. Leave comments in the comment section. Peace.